So here, this is the some of the muscles in this diagram. Let's start with the head region. What are the muscles in the head region? Here we have the temporalis, masseter, orbicularis oris, zygomaticus, and orbicularis oculi. So orbicularis muscles are like orbit. And if they are around the eye, then we call them oculi. If they are around the mouth, then we call them oris. And then you see the platysma muscle here. This is the most superficial and thin muscles in the neck. This is the thinnest muscle in the body. This is like a membrane. This is not thick muscle. Okay. So this is the thinnest muscle in the body. Apart from the head region, let's come to thorax region and abdomen. So what are the muscles in the thorax and abdomen? Superficial muscles. Here, the main muscle is the pectoralis major. Pectos means chest, and this is the main muscle, so we call them pectoralis major. If you remove pectoralis major, then deep to pectoralis major, you have pectoralis minor. You can see pectoralis minor, serratus anterior. Here, I'm just going to list muscle because this diagram is not big and highlighted, so it's not very good. Let me, if I can magnify it. Yeah, I can magnify a little bit. Okay, so that is pectoralis minor, pectoralis serratus anterior. And deep within that muscle, you will have intercostal muscles, external and internal intercostals. In the abdomen, what is the most superficial muscle?
External oblique.
External oblique. So here you can see external oblique. And if you cut this external oblique, then you're going to see internal oblique, transversus abdominis deep to that. And anteriorly in the abdomen, there is another superficial muscle that is called rectus abdominis. But still, the most superficial muscle is the external oblique. Okay. Now, muscles in the upper limb. This is deltoid. And then you have biceps here. And posteriorly, you have triceps. If you remove biceps, then under the biceps, you have brachialis. And then in the arm, in the forearm muscles, the boundary middle muscle, small muscle is pronator teres, which pronates your hand. And then lateral to pronator teres is brachioradialis. And medial, if you go, flexor carpi radialis and palmaris longus. Okay. Then you come here in the lower limbs, superficial muscles. In the cavity of the iliac bone. So if iliac bone inside cavity is filled with this bone, this you're going to see in upcoming slides. Iliopsoas. Iliopsoas is made up of two muscles, iliacus and psoas muscles. Together we call them iliopsoas. Then the talar muscle, long talar muscle, this is called sartorius, you see here. And then lateral to sartorius, you have in the thigh, rectus femoris. It is straight, and this is on the femur, so rectus femoris. If you remove rectus femoris, or we can see lateral to rectus femoris, and under it is vastus lateralis. In the medial side is vastus medialis, And if you remove rectus femoris, you're going to see vastus intermedius. Okay. Then in the leg, the muscles we need to know is tibialis anteriorly. And posteriorly, the calf muscle is gastrocnemius. If you remove gastrocnemius, then under it, you have soleus muscle. Okay. Now the posterior muscles, the muscles which we need to know. Trapezius, trapezium-like, you see. Trapezius. Then over the scapula, here is the spine. Inferior to the spine, you have infraspinatus. Its name comes from the spine of scapula. If you go above the spine, then you're going to see, and you remove trapezius, then you're going to see supraspinatus. In the limbs, upper limb, posteriorly, you have which muscle?
Triceps brachii.
Triceps brachii. And then under the infraspinatus, you have teres major. And if you remove this muscle, then you're going to see teres minor too. There is rhomboidus. Remove this muscle and you're going to see rhomboidus major and minor. The angle between the trapezius and the latissimus dorsi, this is small angle, is called triangle of auscultation. If you put this stethoscope here, you're going to hear the lungs and heart sound. And the posterior muscle in the forearm, you have the brachioradialis, you have flexor carpi ulnaris, extensor carpi ulnaris, these muscles. And in the thigh, you see here, the muscles in the buttock area is gluteus medius, gluteus maximus, based on their size. And if you remove it, then you're going to see gluteus minimus. On the back of the thigh, you have biceps femoris laterally. And medial to biceps femoris, you have semitendinosus. And under the semitendinosus, you have semimembranosus. These all muscles together is called hamstring muscle, these three muscles. Like when they hang the ham through these muscles, that's why you call them hamstring muscle. In the calf, you have gastrocnemius. Under the calf, gastrocnemius, you have soleus. So these are the muscles. You see, gastrocnemius tendon is attached to your calcaneus, and that is also called Achilles tendon. Achilles is the name to a warrior in the Greek mythology. He was the most powerful person, okay? Okay, so now muscles of the facial expression. What are the muscles in the face which make your face express a different feature of the face? That is, they are lined in the face and scalp, and they are thin and variable in shape. Most of the muscles, skeletal muscle, are inserted on the bones through the tendons, but the muscles in the face are inserted in the skin. That's why they can produce very fine movement. And they all are innervated by seventh cranial nerve. So now the same muscles, but in detail, you can see this is the temporalis muscle, and here is converged tendon of temporalis muscle. But here, this area in the temporal bone, the tendon is fanned out, and this kind of tendon is known as what? If the tendon is fanned.
Aponeurosis.
Aponeurosis, very good. That's called aponeurosis, okay? You see here, then similarly here, Galea aponeurotica is another aponeurosis. In the muscles in the face, you can see orbicularis, oculi, orbicularis, oris. And then muscle we need to know, zygomatic muscles. Zygomatic is smaller one, is more medially, and more laterally is the bigger one, zygomaticus major, minor and major. Together we call them zygomaticus. Then another muscle is the buccinator. This muscle is responsible for whistling and sucking. And lateral to that, in the cheek, you have masseter muscle. This is the chewing muscles, most powerful chewing muscles, okay? Here is sternocleidomastoid muscles. Why we call it sternocleidomastoid? Because these muscles originate from the sternum and clavicle and inserted through the tendon in the mastoid process of temporal bone. That's why we call them sternocleidomastoid. And the neck.
Professor? So is that one of the exceptions in that the origin is inferior to the insertion?
Yeah, there are several, like in the trunk and face, it does not apply much. In upper and lower limbs, that applies, but in you may have some variation in the trunk region and in the face region.
Okay, thank you.
So this is the plastrisma here. 4 main pairs of muscles involved in mastication. So what are the muscles of mastication? They are the prime movers of the jaw closure, and they all are innervated by 5th cranial nerve. So jaw closure is by masseter and temporalis, and side-to-side movement is pterygoid muscle. Compression of the cheeks is buccinator muscles, or whistling, sucking is by the buccinator muscles. So these are the 4 main group of muscles of mastication. So if in the exam, if you see which one of the following is not the muscles of mastication, you need to know. This is in our list too. You see, main muscles of mastication here: temporalis, masseter, buccinator, pterygoid. Now muscles of the anterior neck here. So neck is divided into anterior and posterior triangle. Let me see here. Where is sternocleidomastoid? This is sternocleidomastoid. The anterior to sternocleidomastoid, let's see, you draw a line, midline here. And then you have a sternocleidomastoid. So this area is anterior triangle. And posterior to this area of the neck is posterior. This is anterior triangle, both sides, anterior and posterior triangle. Okay, boundary is sternocleidomastoid. We're going to see that later. So what are the muscles here which we need to identify in the neck? First is digastric. It has 2 belly, anterior belly, and you cut posterior belly. It also goes and attaches here. Then you have thyrohyoid muscle here, omohyoid muscle here, sternohyoid muscle here, and sternocleidomastoid. This is sternothyroid, but most important muscle in the neck is sternocleidomastoid, mylohyoid, and digastric muscles. You see in the cadaver the same muscles: sternocleidomastoid, sternohyoid, sternothyroid, omohyoid, and under the omohyoid, you see internal jugular vein. We have cut the sternocleidomastoid to see these structures in the left side. Here is Pectoralis Major. Sternocleidomastoid. Trunk extension, deep. We don't need to worry about these things. Okay. Breathing. So what are the important muscles for the breathing? From your list, what are the muscles which involve in breathing?
Is it the internal intercostal and the external intercostal?
The most important muscles for the breathing are two types, yes? Inspiration and expiration. So breathing in, breathing out. Inspiration, the main function, inspiration is performed by two main muscles, and that is diaphragm and external intercostal. And then expiration is by passive recoil. None of the muscle work actively for the expiration. But when you are breathing in forcefully or breathing out forcefully, then you need other muscles like internal intercostal muscles, okay? So deep muscles provide movement of breathing. External intercostal lift the rib cage. Internal intercostal aid expiration during heavy breathing only, not during the normal breathing. The diaphragm, most important muscle of the respiration, flattens as it contracts and increase the volume of the thoracic cage. So diaphragm is dome shape. Can you see my hand? Diaphragm is dome shape, and this dome is lying in my thoracic cavity. When it contracts, it goes down. When external intercostal contract, rib cage goes outside. So it increases the volume of the thorax, and then air comes in, and that is breathing in. When they relax, then again it goes up and thoracic cage comes inside, and that exhale. That's how two muscles are important in breathing in during rest, and that is the diaphragm and the external intercostal. How are you going to find out which one is external intercostal and which one is internal intercostal? Internal is inside, external is outside. Basically, that's why it is internal and external. So let's go first external. You see, this is your sternum. Here is rib cage. And here is muscle between the ribs. That's why we call them between rib costa, intercostal. So this is external intercostal. You see the fascicles of external intercostal muscle is running superior to inferior and lateral to medial. So direction is superior to medial. Sorry, lateral to medial and superior to inferior. This is the direction. This direction is facing towards the sternum, all the fibers. But if you see internal intercostal muscle, you see, fibers are superior to inferior, but medial to lateral. So these two, let's see if this is my external intercostal muscles, this one external and internal, two external intercostal muscle. They are this way, crossing with each other. They are at perpendicular to each other. Okay. Here is the diaphragm. You are looking from the inside, somebody's diaphragm, and you are looking from the bottom. So you have here vertebra, and then you can see this is the central tendon of diaphragm, and all the diaphragm muscles are attached here. You can see the xiphoid process of sternum. Muscles of the abdominal wall. Earlier we talked about it. So most superficial muscle, external oblique. And these are the tendons of external oblique. And their aponeurosis, they all becomes and attached then to the inguinal ligament. And then they insert on the pubic bone. You see the tendon here inside? sometimes this tendon remains intact, opening here. And the content of the stomach intestine can pass through here. And that is called hernia. Okay. So most superficial muscle is external oblique. When you cut it, you're going to see internal oblique. And then if you cut deep to it is transversus abdominis. But if you come into midline, you have 1, 2, 3 piece of muscle either side. This is called six-pack muscles. And they are rectus abdominis. They are inserted into the tendons and in the central tendon that is called linea alba. So if you cut, let's see, if you cut at the level of 3 muscles where you have all the muscle, let's see, external oblique, internal oblique, you cut here. And then you see how it looks. So it is front, anterior, and it is inside. So you have a skin. Under the skin, you have external oblique, this muscle. Then you have internal oblique, then you have transversus abdominis. But you go in center, then you have only a rectus abdominis muscle. Okay.
So is the rectus abdominis like just as deep as the internal oblique, or a little bit superficial, more superficial?
It is superficial. In the center, it is superficial. But even the tendons are covering all the way. So if you go in the center, it is rectus abdominis is superficial. At the level of, you can say at the level of internal oblique. Okay, now pelvic floor muscles. So you know pelvis is formed by 3 bones. And that is ilium, ischium, and pubis. And posteriorly, it is also covered by another bone. What is that bone called?
Sacrum.
Sacrum. And that cavity is called pelvic cavity. And on the floor of the pelvic cavity is nothing. So how are you going to hold all the pelvic organ? That's why there is pelvic floor, and it is built with a lot of muscles. Let me go back and talk a little bit in abdomen. Do you know in abdominal cavity, like each cavity in the body is covered by bones. Imagine your head, cranial cavity by cranium, pelvic cavity by pelvic bones, thoracic cavity by thorax. But this abdominal poor area, there is a lot of soft organs, liver, spleen, pancreas, small intestine, large intestine, everything is there, but it is not covered by any bone except the vertebral column on the back. So to protect this area, there is interlacing of strong muscles. And that's why there is like muscles fibers in different direction. You see, this is transverse, this is oblique, this is a straight vertical to hold things inside the abdomen and protect the internal organ. Okay. Similarly, to hold the pelvic organs, we have pelvic floor or pelvic diaphragm. And there are 2 groups of muscles which support pelvic organs. That is levator ani and coccygeus muscle. Okay. So this is pelvic floor, and you are looking from the top. So this is anterior, here is posterior. You can see the female, this is the female pelvis. So you can see 3 openings. If it is male pelvis, you will see only 2 openings. The middle opening will be missed. Now the muscles. Levator ani is formed by 2 muscles. Pubococcygeus, name is by which bone they are attached to. So pubic bone and coccyx bone, that's why I call them pubococcygeus, and iliococcygeus attached to ilium and coccyx. So these 2 muscles together is called levator ani, and posterior part of the pelvic floor muscle is the coccygeus muscle. and some piriformis muscle. Okay, so if you combine levator ani and coccygeus together, we call them pelvic diaphragm. Okay, and there is another muscle. This is urogenital diaphragm here, and there will be circular muscle around the urethra opening, and that is called urethral sphincter. Okay, so this is in female due to multiple pregnancy, means a lot of pregnancy, and hormone during the pregnancy time, progesterone, they make these muscles very lax, weak. And that's why if somebody has vaginal delivery of multiple babies without medical attention, in that female, these muscles lose their tone. And after certain age, they prolapse their cervix, uterus, and it comes through the vaginal wall opening. And that's called uterine prolapse. It is very common in poor countries with the female.
Professor,
Uh-huh.
I had a quick question. In the PowerPoint, it says the levator ani is made from 3 muscles, but in the diagram, it shows 2.
Which
Is it
3
only
muscle?
2?
Which 3 muscle it says? Levator ani?
It says iliococcygeus, puborectalis, and pubococcygeus
Puborectalis.
from the slide before. Right there, the 3.
Yeah, puborectalis. Yes, you can add there. In this diagram, we are missing that, I think. Puborectalis.
So it's technically made from all 3.
Yeah, it is another group of muscle which is deep, and you cannot see here, that's attached to pubis and rectal area to the bone. That's called it puborectalis.
Okay, so technically it's 3 muscles that make up the levator ani?
Yeah,
Okay, thank you.
puborectalis. This is deep. We cannot see here. Pelvic diaphragm, levator ani. Thanks for reminding me, but I don't see. Let me check it, okay? Do they put in that class or not? Sometimes they have error too. For me, I am doing like this is only 2 muscles which are the part, but they are muscle of the pelvic floor too. Okay, so the superficial muscle of the anterior thorax now. Sternocleidomastoid again, the pectoralis major, biceps brachii, deltoid. Here, the pectoralis minor and pectoralis major was there earlier. Here. So pectoralis major is superficial and pectoralis minor is deep. You have to cut and remove pectoralis major to see pectoralis minor. Movement of scapula. These are the 4 muscles which plays role in trapezius, levator scapulae, rhomboides major, rhomboides minor. You will not be asked which one of the muscles are responsible for movement of scapula, so you don't worry about it. The rotator cuff muscles in the back. We have done that last time. What are the rotator cuff muscles which rotates your shoulder joint?
Supraspinatus,
1.
infraspinatus,
Mhm.
teres minor,
Mhm.
and subscapularis.
Subscapularis. Good. So here, First, always when you read the superficial muscle and then it is removed so you can see deep muscle. So this is trapezius here and deltoid here. And then here latissimus dorsi. If you remove trapezius, then you're going to see another muscles in the group. Yeah. So you have rhomboid muscle. Rhomboid is the structure. So rhomboid minor, rhomboidus major. Here, teres minor and teres major. What connection you can make here between rhomboidus major and rhomboidus minor and teres major and teres minor?
They're all attached to the scapula.
Yes. And both of them are deep muscle. In both muscle, which one is superior, major or minor?
Minor.
Minor. And major are inferior. Are you guys following me?
Can you repeat that again? The why it's inferior and why it's the minor would be inferior?
Do you see where they are?
Yeah.
Which one is above, which one is below? Let's see first rhomboidus major and minor.
Oh, I see. That's what I'm looking at. Sorry, I was looking at teres minor and teres major.
So same thing in teres minor, major too. Which one is superior?
It's teres major, isn't it? Or no, it's teres minor.
Yep. So both minors are superior and both major are inferior.
Okay.
Movement of the arm, use pectoralis major and minor, pectoralis major and deltoid, you see? So these two muscles contract. When they contract, what they do? They reduce the length of the muscle and pull the joint. Here is the same muscles on the back again. Supraspinatus, infraspinatus, teres minor, teres major. And here will be the rhomboidus, rhomboid major and minor. Here is biceps, triceps, brachii, 3 heads, lateral head, long head and short head. And then attached to the olecranon process of ulna.
Why is there an asterisk on the on a few of them?
Huh?
There's an asterisk at the end of supraspinatus, infraspinatus, and teres minor. Is there a reason for that?
Just the deep muscle tissue, they have done that. So it's not a big deal. This is the same muscles. Okay, let's see the muscles in the arm now. Sorry, forearm. So forearm anterior view, you see this is always look for pronator teres, which pronates the palm. So pronator muscles, and then you go medial or lateral. So from pronator teres, if you go medially towards the thumb, the big bulk muscle is brachioradialis, which you need to know. And then if you go lateral, then you have flexor carpi radialis. Flexor carpi radialis means they flex and they are attached to the carpal and radius. Then there is palmaris longus and then flexor carpi ulnaris. Why do you call palmaris longus? Because it has a long tendon and it reaches up to the finger. Same thing here. These muscles. Posterior compartment of forearm, posterior muscles. Again, you can make enconius one of the boundary, and then you go lateral. You have flexor carpi ulnaris. Flexor carpi ulnaris, then extensor carpi ulnaris. So extensor is more back than flexor. Flexor is like at the junction of anterior and posterior. That's why it flex. That's why we call them flexion. Then you have the extensor digiti minimi, and then this big tendons is extensor digitorum. Digits means finger, so it goes to the fingers. That's why we call them extensor digitorum. And then there is a small muscle, extensor carpi radialis brevis.
Dr. Shaw, I have a question.
Uh-huh.
When you say that the extensor muscles are more back to the flexor muscles, do you mean that they're like deeper? They're more inferior to the superficial flexor muscles?
No, flexor muscles are anterior.
Oh, okay.
Extensor muscles are on the posterior, means back, not in inner. I'm not saying deep. I'm saying in the posterior part. So this is
Okay.
this is the posterior part of the forearm.
Okay. Okay. Thank you.
Okay, so thigh muscles now. Here, this is the iliac crest, iliac bone of the hip bone. And the whole cavity in the iliac bone is filled with a muscle. That muscle is called Iliopsoas. This is made up of two muscles. The main bulk muscle, which fills the cavity of the iliac, is iliacus, and here is psoas major muscle. Then this long muscle is called talar muscle or sartorius. Then here is the Quadriceps femoris. Quadri means four, and they are found in the femur area, so we call them Quadriceps femoris. So what are the muscles of the Quadriceps femoris? They are Rectus femoris and three vastus muscle. Laterally, you see deep to Rectus femoris, laterally vastus lateralis, medially vastus medialis, and if you remove Rectus femoris underneath, you're going to see vastus medialis. Sorry, vastus intermedius. Okay. So these are the major thigh muscles. And then here is tensor fasciae lati, big tendon. Okay. The rectus femoris is attached here to the patella through a big tendon that is called tendon of quadriceps femoris. They all converge here and attached. Okay. So these are the quadriceps muscles. Posterior muscles. They all originate on pelvis or sacrum. They are gluteus maximus, medius, and minimus. And here you go. This is the iliac crest here. And you can see the most superficial muscle is gluteus maximus. You have cut the gluteus and open it. So you can see gluteus medius. Medius is here. And under the medius, you see gluteus minimus. And there are other muscles, piriformis, obturator, internus, quadratus femoris, these other muscles. But this is the glute muscle, three of them. If you don't open it, then you see gluteus maximus, gluteus medius, and remove this gluteus medius, underneath you will have gluteus minimus. Now in the thigh posterior muscles, we have biceps femoris. This one, most lateral muscle. And then if you go slightly medial, then you're going to see semitendinosus muscle, these two. Under the semitendinosus, you have semimembranosus muscle. Okay. These muscles together are called hamstring muscle. It's like in the old British time, England, they used to hang the ham in the meat shop through these muscles, and that's why we call them hamstring muscles. Muscles of the leg, you know, there is only 3 main muscles in the leg. That is tibialis anterior, this one. And then if you go posteriorly, then you have gastrocnemius, and underneath you have soleus. These 2 muscles you need to know. You see, gastrocnemius has 2 heads. That's why it looks like 2 muscles, medial head and lateral head. And if you cut and remove gastrocnemius, then you're going to see soleus. Okay, triangles of the neck. This is very important. You will be tested on this. Okay. So this is sternocleidomastoid, posterior to sternocleidomastoid, and anterior to trapezius, and superior to clavicle. This yellow triangle is called posterior triangle. Midline of the clavicle, the neck, and under the mandible, anterior to the sternocleidomastoid. This area is anterior triangle. So this is the sternocleidomastoid muscle, which divide your neck, half of the neck. Like you have center, and then you have the right side neck and left side neck, and you divide right side neck into 2 triangles. Because this is important clinically. If somebody has cut, damage, or trauma to anterior or posterior triangle, you can find out which organs are damaged in this area and how life-threatening they are. So here you go. In anterior triangle, I am going to give you 1 minute, list the structure in the anterior triangle and structure in the posterior triangle. List yourself, look at it. List only artery, veins, and nerves, not other structure. List artery, veins in anterior triangle and posterior triangle. Artery, veins, and nerves. Okay. So if you have made the list in the anterior triangle, you see what do you have? You have internal jugular vein, main structure, common carotid arteries, and branch of the common carotid artery, you see, external and internal carotid artery. And you have another gland that is called submandibular gland. In the posterior triangle, you have brachial plexus, phrenic nerve, subclavian artery, external jugular vein, and accessory nerve. So let's see if somebody has cut here under the mandible. People will bleed from this common carotid artery and stop supply of blood to the head, and people will die immediately. If somebody has damage here, if they damage phrenic nerve is the nerve which controls your diaphragm. So if this nerve is cut, that side of your diaphragm will completely paralyze, and respiratory failure can kill the patient. Okay, so these are the structure, and they're going to damage if there is. This is the pubic tubercle here and superficial inguinal ring. These rings are closed before birth, but in some people they are intact. And if the muscles, anterior muscles are weak, then abdominal content can easily pass through this, and that is called hernia, inguinal hernia. You see the here, doctor is filling the hernia after asking the patient to cough so they can feel the bulge of herniated organ. Some other thing here, You see the triangle here? This is the boundary of scapula, and then you have boundary of the trapezius muscle. And then this is latissimus dorsi muscle here, and it is a small triangle. That triangle is called triangle of auscultation, to listen to the lower lobes of the lungs. Common site of intramuscular injection. Where can you give intramuscular injection? Common sites. Intramuscular injections. So wherever there is a thick bulk muscle, you can put the intramuscular muscle injection, because the medicine in the muscles will spread slowly and spread and then go to the blood vessel and go all parts of the body. So number one, deltoid.
Deltoid and gluteus.
And gluteus, which one?
Medius.
Gluteus medius.
Mhm.
Do you know why? Why not medius?
Because of the sciatic nerve.
Yes, if you give in this area, and not everybody has nerve here. Sometimes nerve is going this way. You can damage the nerve and whole paralysis will occur. So always what we do, let me show you what we do. So what we do, we divide the butt area into quadrant.
And square, quadruple. Mhm.
For quadrant. So you don't give here. Nope. Nope. Pretty much nope here. This is the area where you give injection.
With the-
Got it? So upper outer quadrant is the location where you can inject the intramuscular injection. Okay. That's all for today, guys. Do you have any question? If then we will